About a year ago was my first shot. We did one shoulder first. I felt after about an hour, instant relief. It wasn't like a big thing of relief, but I know that I had excruciating pain, both shoulders. Left side started coming around like quick, like within a few hours. I was just using it normally. I wasn't trying to pick up any weights or do anything extreme. I just felt happy that, wow, that one piece of pain that was just keeping me from going to the gym, I felt kind of confident that I could, at least pick up a little bit of weight. And then that Monday, we did this shoulder.
Joey, to help maybe folks that are looking at this, is when was the first time this occurred, and why did you come in?
Well, you were mentioned to me by a client that I had, and I was telling her about my issues and all that, and just staying out of the gym for so long, and then she gave me your name, and I called Denny, and he got me in here, and everything that I talked to him over the phone sounded great, and I said, man, if this could really work, I could plan a comeback. And that was jokingly on the phone. That wasn't like anything serious. I was like, wow, if I could just even remotely get to just work out, not just to make a comeback. But that from that day on, from the injection, I just started getting instant relief. I felt more confident about, even like picking up weights for clients. I mean, I literally have to clench my teeth to pick up a weight and put it up on there, and they don't know how painful it is. Or taking something and just bringing it up this way was just excruciating, And then these are 10-pound plates. Imagine a 45-pound plate. I'm just grinding my teeth. But from that point, first week back in the gym, I think I called you. I was like, wow, I just was able to work out a little bit.
Had you received a diagnosis from a conventional joint specialist, like an orthopedic surgeon or someone to that effect, and had you had any imaging?
I had MRIs previously. They're a long time ago. I remember these injuries were 10 years ago. But since I only retired from bodybuilding, I'm going to say 4 or 5 years ago, that's when, I stopped working out, and then I wasn't getting the full effect of, my training anymore. So that's when I officially retired. So it's been, 5 years. Oh yeah, I did the MRIs, and I have a tear on this side, and in fact, I wasn't going in for a shoulder, I was going in for my lungs. So when they took the MRI from here down, they saw the tears on the shoulders. This one, over time, was bone on bone for sure. I mean, because you could hear it grinding. I mean, it was just, even hoisting anything up, you could just hear it clicking and grinding, and it was just, everything I did was just painful.
And you came back, and what did you win with your newfound capacity with your shoulders?
I entered the Harbor Classic in Port Charlotte, the now Chancey show. I was planning on doing the All South with that, which I had won. I'd be returning champion back in 2007. That's the picture you have. But going back, it was after about 3 or 4 months, that's when I decided, because everything started coming back. The shape was coming back. I started seeing things that I'd seen before, which kind of made me excited. So that's when I decided to do the show. And then I would say 10 months later, I was on stage. From I saw you to the show, I entered 4 categories. I was the only one in the show that entered more than one competition.
Wow.
I took first in 2 categories and second in the other 2. Which was a political decision because they say I should have won the whole thing. I had beaten the guy in one category, not in the other. So when I came back for the night show, they put me in second with the other category. And he was younger. It was it was in the open. So I was going against young guys. I'm in my 50s, and he's 30s and maybe 40s. Who knows? But I'm not saying that was anything. But that's what I was going up against. But I still brought it.
So this is an excellent example of a question that I get all the time. Doc, how about me? I have bone on bone. If you do this, are we going to take x-ray imaging later and show how wonderfully I've recovered? And I tend to not force follow-up imaging because I say your body is the best indicator of what's going on. And so I know you have healed an immense amount, and I would say that most of the credit goes to you. A lot of credit goes to the techniques we used, and there's some supplements that I recommend that help, like a glue to solidify healing. So this is a great example to answer that question. I haven't furthered imaging you. You have more trophies than everyone else that came to that competition.
Yes.
And you went about natural alternative methods. We didn't have to use the word corticosteroid or arthroscopic surgery in your healing, and so that's why we're making this video.
I followed the protocol identical to what you told me from start to finish. I believe that everything that you told me was happening because as I was taking the supplements and I was doing it religiously, because that pain, only the people with shoulder pain or kind of joint pain can only describe it. I wanted to go away so bad that I just did everything, and then just following the protocol. I noticed within 3 to 4 months after the injections that my joints were coming back. I still get a little bit of noise, but there's no pain. And I know that bursa has come back. Everything has just rejuvenated itself.
Yeah.
Because I just have more blood flow. I noticed that my delts were the same size now, where this one was very small because I couldn't lift anything, and this one had inflammation. So my symmetry was way off. And when I was looking at myself in the mirror, and I said, it's done, it's over. It's not going to happen. But
when we turn the video off, I'm going to share with Joey a new trick that I've figured out. So that's going to be our theme to entice people to learn more tricks from us.